You're so silly. This is Lola, and she's super cute, and she likes to attack my yoga mat sometimes because you know what? She's just kind of rude. She's just rude. But let's talk about biomedical ethics. Welcome to week 4 of Philosophy 260 WI Biomedical Ethics. This week we are moving into chapter 4 of the Vaughan text, Truth Telling and Confidentiality. The major themes of this chapter have to do with when is the right time to tell the truth to patients and when is the right time to tell the truth about patients. This is a very complex ethical issue, and I'm looking forward to reading your discussions about it this week. But first, let's talk about short essay 2, which is again composed of aspects from your discussion board activities. In your discussion board for this week, you must provide an example of a medical case that involves issues of patient autonomy, paternalism, informed consent, patient confidentiality, and/or truth-telling. In this essay, you must explain how this medical case, using hyperlinks to cite where applicable, relates to our course materials. In your OP, you only have to provide a short discussion, that is in your original post about it, but in your paper, you must identify more meaningfully the complex nature of your biomedical ethical issue. You must make direct references to the materials from Chapter 3 and Chapter 4. You may also reference your previous readings as well. While you may use some of your work from your discussion boards, it is important that this essay be clear and focused on the task at hand. Be sure that your argument is original and not lifted from one of your sources. Finally, you must also provide a short personal response to this ethical issue and how it was handled. Do you think there was a better way? What would you have done in this situation? Okay, now to the matter at hand. As I said before, the chapter 4, which we're reading this week, is titled Truth-Telling and Confidentiality and is concerned with major issues in bioethics surrounding confidentiality. As Vaughan states on page 176, the debates surrounding this important issue come down to a discussion about paternalism and the fight or conflict between autonomy and beneficence. Let's get into some arguments and counter-arguments regarding truth-telling and deception in the medical field. So, an argument against full disclosure of a patient's situation, if they have cancer or not, that sort of thing, is that truth-telling can be injurious, evoking in patients feelings of panic, hopelessness, fear, and depression. And a counter-argument to that is that many exaggerate the harm done to patients by full disclosure and underestimate the beneficial effect of truthfulness. And they also fail to recognize that misleading or lying to patients can also itself do damage. Another argument against full disclosure, patients do not want to know the truth, especially if the prognosis is grim. A counter-argument to that is that data from surveys suggest that most patients really do prefer to be told the truth about their diagnosis. Another argument against full disclosure is that physicians have no duty to tell patients the truth because patients are incapable of understanding it. A counter-argument to that is one, even if communicating the whole truth is impossible, physicians still have an obligation to try to convey to patients the essential and relevant information, and two, conveying the whole truth and nothing but the truth is actually unnecessary. The main argument in favor of truth-telling is this: we must always respect people's autonomy, their rational capacity for self-determination. Full disclosure respects their autonomy. Truth-telling is concerned with telling truth to patients. Confidentiality is concerned not with telling the truth and is related, Confidentiality is concerned with not telling the truth, that is, the truth to other people besides the patients, and is related to perceived right to privacy. Confidentiality is an obligation or pledge of physicians, nurses, and others to keep secret the personal health information of patients unless they consent to disclosure. Right to privacy is the authority of persons to control who may possess and use information about themselves. You guys might not want Mark Zuckerberg knowing about your personal health issues, but maybe your mom or your girlfriend or boyfriend need to know those health issues. This slide contains information from the box on page 181. A study of 800 elderly subjects show that major differences exist in the way people of different ethnicities view the issue of truth-telling. Two views of truth-telling are that truth is an essential tool that allows the patient to maintain a sense of personal agency and control, and that telling the truth is empowering. And another view is that the truth is traumatic and demoralizing, sapping the patient of hope and the will to live. Truth telling is an act of cruelty on that view. Here are some arguments for confidentiality. Without respect for confidentiality, physicians would have a difficult time fulfilling their duty of beneficence. Without respect for confidentiality, trust between physician and patient would break down. Disclosure of confidential medical information could harm patients, and persons have a right to privacy. However, there are some counter-arguments to this. I recommend you check out the cases at the end of the reading to think more critically about the importance of confidentiality. And so our questions are, is the obligation to respect confidentiality absolute and applying in all cases? Or is it prima facie, allowing exceptions when other duties obtain? Then when we think about the other duties, so for example, if a patient has tuberculosis, that has to be, and a doctor finds out their patient has tuberculosis, it has to be reported to the Centers for Disease Control. And there's a version of tuberculosis that cannot be treated by the medicines that we currently have. And so people with that version of tuberculosis often might be medically quarantined for a time in order to not spread that disease more. And so this is a conflict in confidentiality that the doctor might have of the patient's right to privacy versus everyone else's right not to get tuberculosis. Let's talk about our assignments for this week. So you have to read Chapter 4, obviously, Truth Telling and Confidentiality, page 176 to 186. I want you to watch Patient Confidentiality. It's the video on YouTube. And for your discussion boards, in Part 1, as I mentioned before, I haven't mentioned this one yet. In Part 1, you must read one of the additional readings given at the end of the chapter, and I'll assign those readings to you. In your original post, you must provide a brief overview of your reading and answer the assigned question. The original post is due by Wednesday at 11:59 p.m. You must then respond to 4 to 5 posts from the readings that you did not read. Connect the post to the readings you did for this week. Be sure to respond to the people who responded to you, and these responses are all due by Friday at 11:59 p.m. In Part 2, you must provide an example of a medical case that involves issues of patient autonomy, paternalism, informed consent, patient confidentiality, and truth-telling. You must provide a link to the case and explain how it is an example of one or more of the above things. You must read at least 2 cases that your colleagues post and comment upon them. These posts and replies are due by 11:59 p.m. on Friday, so you can just add them to your main Part 1 if you wish. So, finally, as I mentioned before, short essay 2 is due. And you can, if you see someone else's post that you really like and you like their medical case, you're allowed to use that as long as you give credit where credit is due and use your own words to describe what's going on there. This is a really important chapter, I think, for our understanding of the nature of disclosure. What do you tell the patient? And then what do you tell the people that are affected by the patient, And I'm looking forward to reading your discussion boards. And as I said last week, I'll probably post another lecture of some kind in the coming weeks. So please stay tuned. All right. See you later. Goodbye.